Welcome back to another episode of the About Mansfield Consumer Advice Series. I'm your host, Steve Casillo, and to my right, that would be your left, that would be Dr. Joseph Adams. Calibration Chiropractic and Functional Health is the name of his company, and today we are continuing our series on concussions. First of all, welcome back, Dr. Joe.
I'm excited to be here.
Outstanding, thank you. And we talked about how back the first episode, the basics of concussion, and then last week we got a little deeper into it. Today we're talking about how concussions are treated. Let's just get right into that. How are concussions treated? And that will actually help me lead into some questions I've got on the back of my mind.
Okay. Yeah. So a lot of times, when you get a concussion, the first thing that needs to happen is you need to go see, a medical professional, right? And, that's really important because they need to rule out that we don't have something that's worse than a concussion, like, a brain bleed, or, a more traumatic type of brain injury. But usually what happens once you meet with that provider and they assess, your risk and, prognosis is that they're going to restrict activity. So if it was a student athlete, then they would take them out of the sport, and then they would also maybe reduce their load at school, and they would do that and monitor their symptoms for a period of time, and then slowly introduce or reintroduce the activities. And what they're looking for is that as you reintroduce maybe the sport that you got concussed in, that doesn't give you symptoms. So it doesn't increase like your likelihood to get a headache, or it doesn't increase your dizziness or your fatigue. And if all that goes well over that period of, like 48 hours to 2 weeks, then you'll gradually get somebody back to their previous status, and they can move on with their life. And during that process, they may use medications to help mitigate the symptoms. A lot of times it's going to be pain type medications. So, medications for headaches, medications for, any type of body pain they have. And so that's kind of like the nutshell of the acute concussion management. Now, sometimes people, may have more severe concussions, and they may need to, send them to PT, maybe if they, are having, neck pain, headaches that are involved with it, or maybe like occupational therapy,
sure, to
help regain some of like their balance or some of their daily activities of living. But that, in a nutshell, is kind of how it's treated in the initial stages if somebody is most likely responding to care.
When there is a concussion, is there inflammation in the brain, and is that something that in a minor case, something as simple as ibuprofen, does that help? I don't.
Yeah. That's a good question. That's a good question because when you do get a concussion, there's definitely inflammation, right? I mean, you've stretched a lot of your nerves, and that inflammation that's taking place in the brain. We've studied that, we've seen that, and it can give not only issues that you would think could be most likely due to head trauma, like headaches and dizziness and things like that, but that inflammation in the brain, neuroinflammation in the brain, can also lead to inflammation in the GI tract. And so it's really common to see people who have all the signs of concussion, up here in the head, neck area in the brain, but then also see them have, constipation, diarrhea, or a little bit of both.
Oh, wow.
Bloating, because that connection between the, gut and the brain is so strong. And, a lot of times the inflammation in the brain goes to the gut and vice versa. And so inflammation is a big part of it. Ibuprofen, it can be used to mitigate that inflammatory component. But you got to be careful with that sometimes too, because there are some studies that show, and I'm not sure if this is specific to concussion, but using ibuprofen or NSAIDs to arrest inflammation sometimes can actually cause people to shift to chronic pain.
Interesting. And you mentioned then some of the symptoms will actually go down into the stomach, and knowing that ibuprofen actually has adverse conditions on the stomach if used over and over and over. So
exactly.
That may not be a good thing. Let's go back. You talked about one of the first phrases you used was brain bleed.
Mm-hmm.
So there are various steps to a concussion? I would assume brain bleed is one of the most severe, bruising, or that there are no symptoms at all.
Yeah, and that's why it is really important to get evaluated by a medical professional. Once you get a concussion, because something that could look like a concussion initially could be way more severe, right? So it's like you could hit your head and you have all the signs of a concussion, but really what's going on is that you have a brain bleed. So you're actually have some damage in there, physical damage, and you're bleeding, and that can be life threatening. And so that's something that is not necessarily concussion. That's a traumatic brain injury at that point. So having any bruising on the brain, any type of bleeding, any type of like fractures in the head, those are the more serious things that can happen, and people need to be evaluated for that, because that brain bleed can be real subtle. Like it could be missed in the beginning, and if somebody didn't take it seriously enough to go get checked out, they may unfortunately regret it, because that could be a life-threatening thing, and can happen pretty quickly.
When someone comes into your office and they think that they've got a concussion, and it has been determined that they do have a concussion, how do you treat them?
Yeah, so if somebody comes to see me, it's probably because they've had it for a long time. It's not getting any better, and they've kind of run out of options, if you will. And so what we're looking at is really a multifactorial assessment of their overall status, and we treat it from a very multifactorial standpoint as well. So one of the things we're looking at is all the neurological deficits they may have, which usually is their eyes not moving the way they're supposed to, not coordinated the way they're supposed to. Their coordination, are they coordinated? Is their balance good? Do they have issues with their pupil sizes, in bright lights? Are they sensitive to sound? Do they have issues, with their GI tract? We're looking at all these factors. So it's like we're doing a very detailed history, very detailed neurological examination. And then once we understand all the different things that are affecting them, all the different, symptoms and what their goals are, then we can build a treatment plan that's very custom to them. Because one thing about concussions is, depending on kind of how you get hit, it'll affect, nerves in the brain differently. And so we build a treatment plan based off of, what deficits they have that's very customized to them, to get them better. And once we understand all that, we're going to be working on the ocular system, which I know we've discussed,
right.
And rehabilitating their ocular system, rehabilitating their balance system, rehabilitating their coordination, and then also working on all of the metabolic issues that they may have, like hormone issues, gut issues, sleep issues. So it's like literally like a bomb just goes off, and you're just trying to put all the pieces back together, and and handle all these different factors. Because the thing is, if you don't address all of them to the best of your ability, then a lot of times those other factors that you didn't address will cause the concussion syndrome to continue.
Can you think of, and maybe tell a story of a patient that you did work on, maybe explain some of the symptoms they had and the way you went about treating it, to where it became a success? You don't have to use the patient's name. HIPAA rules and stuff, but got a success story that immediately comes to mind?
Yeah. I actually had a lady who was in a boating accident. She was wakeboarding, and she fell. The rope got stuck on one of her arms, and she got dragged to the bottom. And we think she hit her head on the bottom. And everybody was really focused on the arm because she almost lost the arm. She still got a scar to this day. And she was had headaches every day. She was dizzy. She had fatigue. She had brain fog, and she wasn't able really to do her job. And she had a very important job. And we started treating her. And the first thing that we do is get all of the trigger points out of the neck, because we got to get people out of their head pain really fast.
Right.
And so we get rid of the trigger points, we adjust the neck, and then we do the ocular rehab. And when we sync up the ocular rehab with everything else that we're doing, we get the headaches to go away pretty fast. And then from there, we go to the dizziness or whatever it may be. So we just go sequentially through each one of these using all the different rehab protocols we've come up with over the years.
Okay. That is another 10-minute nugget of information. If someone wanted to reach out to Dr. Joseph Adams regarding concussions or anything else chiropractic related, how do they find you?
Yeah, so the easiest thing would be just go to calibrationmansfield.com, which is our website, and on the homepage we actually have some PDF booklets that you can download. It talks about concussion, migraine, some of the other bad stuff that we treat, and we're all over social media, so we're not hard to find. CalibrationMansfield.com. That is Dr. Joseph Adams, Calibration Chiropractic and Functional Health right here in Mansfield, Texas. And coming up next week, we have another episode on concussions. We'll see you next week. All right, we'll see you then, buddy.
We appreciate you listening to the About Mansfield Consumer Advice Series. By the way, if you own a business and you are interested in being a part of the Consumer Advice Series, if you have the knowledge to give information in 10-minute increments to the consumers, shoot me an email to info@aboutmansfield.com. Again, that is info@aboutmansfield.com. We'll tell you how we can get you all set up. Appreciate it. We do it again next week right here on the podcast.